From the White House. Joining me now, Dr. Cyrus Shapar, former Centers for Disease Control official. He's now director of Resolve to Save Lives. Doctor, I was planning to have an extensive conversation with you about other issues, but let's get straight to this. The President of the United States, a military aide who works very closely with him, has tested positive for coronavirus. And the President was retested, and that test shows negative. But this aide was exhibiting symptoms yesterday. If it were you, if I showed up or you showed up at your doctor and that was our story, someone who had been within inches of us, who had symptoms yesterday, tested positive, what would your recommendation be?
Recommendation would be to quarantine for 14 days from the last contact with the confirmed case. In this case, the valet, and that means staying home, no visitors, separating yourself from others, monitoring for symptoms, wearing a face covering when you're around others. Ideally, you're not. But that would be the recommendation.
And so let's step back. This is the President of the United States. So it's not you and it's not me. You might call him the ultimate essential employee. He is the President of the United States. Can he sit in the Oval Office today with the governor of Texas and have a meeting about America's reopening? Can he have his normal national security and other briefings as long as people are kept at a social distance? Or is that unwise?
I think it's unwise from a public health standpoint. We all don't want to transmit disease, and in this case, as a high visibility person, I think he should set an example and really go into that quarantine for 14 days. And don't put too much stock into one negative test. It takes time to develop enough virus to test positive. So one test today doesn't necessarily mean that over the next few days it might be something. It might not be something different.
Right. And again, my questions here are not to cause alarm. And the President was retested, and he's negative. And let's hope that when he's tested tomorrow and the day after, because we know he will be now, that those tests continue to turn up to be negative. But walk us through the concerns here in the sense that we can show you some video. We can show our viewers some video with the President getting off Air Force One. The President gets off Marine One. There are military aides around him. But more importantly, inside the White House, this is elite duty. It's prestigious duty. These aides, if the President needs food or drink, they bring it to him. They help him through the personal residence sometime. We don't want to show pictures inside the White House because we don't want to show someone who's not this person, or we don't want to misidentify people. But they operate in incredibly close proximity to the President. And again, that service is a privilege. But right now, it also appears to be a risk.
Yes, that level of contact we know is a significant risk for transmission. It's the type of situations like household settings when you live with people and are interacting with them for a long time. That type of contact has high rates of transmission. So the amount of access this person had to the President is concerning. And I think what we say about the President also needs to be extended to others in the White House that this person might have come into contact with.
Right, and that's where I wanted to follow up, because we do know that the White House is doing temperature screenings of reporters if they're going to be in the briefing room or anywhere near the President. They're doing temperature screenings and testing of members of the coronavirus task force, people who are going to be in close proximity to the President. And the reason we know this military aide tested positive is the aide exhibited symptoms and was given a test. So the tests are available at the White House. But if you were called into a meeting right now and said, okay, a personal valet to the President of the United States has tested positive, here's what we're doing today. What more should we be doing immediately to get more protection, not only around the President, but around the Vice President, the Chief of Staff, other vital people in the West Wing of the United States? What should they be?
Well, we should be interviewing the person who tested positive to try to identify who his contacts were. Who was he in contact with even up to 2 days before developing symptoms, basically throughout his entire infectious period. And then, of course, after identifying those contacts, letting them know that they've been exposed, and then following up with quarantine.
Can you go to the President of the United States and say, sir, I'm sorry, but you need to dial it back, at least for a few days until we have a better perspective on this? You tell me. In the last couple of months talking to doctors, some people say it takes 3 days, it takes 5 days, could take as long as 14 days to know if because you've been close to somebody, you've been potentially exposed, whether you actually were exposed and get the coronavirus. Can you tell the President of the United States, sir, I'm sorry, you need to dial it back?
I think as he recognizes the significance of the disease that's going on and affecting everyone around the world, this type of adherence to public health measures is extremely important. And not only is he essential, but also the people that he interacts with. So preventing transmission amongst all of those leaders here in the United States is extremely important. So even being more conservative might be an approach to take, just to make sure that our leaders aren't broadly affected.
Before I let you go, Dr. Shapur, the reason that originally we were going to talk to you is this right here. This is 17 pages, a draft CDC document, recommendations, guidelines for American businesses, American restaurants, American churches, American school administrators about how to go about this process. If you read this document and the caution it recommends in phase one, again, the president's supposed to meet with the Texas governor today. His plan is way out over the skis of these recommendations, if you will, when it comes to restaurants, when it comes to houses of worship. The White House saw these and said no, and set them aside. What does that tell you about who's calling the shots, or what philosophy is calling the shots now in terms of being aggressive or listening to the scientists?
Yeah, I think it's important. This could be a useful document. We've heard that. This fills a void that we have now on comprehensive, consolidated guidance, really specific guidance on what different people should expect as we loosen measures. And so it's something that could be useful. I think in the absence of this kind of federal level guidance, we have states taking it upon themselves to develop things based on what they can find, based on their local expertise. But we end up with plans that are highly variable across states, and I'd say, a variable quality. So it's more of a fragmented approach, and I think that that's less than ideal.
It's great detail in here. Obviously, they've shelved the document, but it is available to anybody who wants to read it. It recommends caution as we go forward. Dr. Shapur, really appreciate your insights today on both of these.